I do want to give a quick update on some of the details we talk about every day. We've now done over 17.5 million PCR COVID tests here in the Commonwealth of Mass since the start of the pandemic. The 7-day average positive test rate is 1.86% and has been under 2% now for several weeks, and obviously that's a huge drop from where it was back at the turn of the year. On vaccines, the Commonwealth is and has been for several weeks a national leader in vaccinations. In fact, Massachusetts leads all other states that have more than 5 million people in efficiently administering vaccines and per capita vaccines as part of our population, both total doses and first doses. And we're number 2 in the country for administering first doses to black residents, with just about 16% of our black residents having received their first dose. And week after week, thanks to the hard work that so many people like the folks here at Brockton Community Health Center do, Massachusetts is among the top 50 states for vaccines being administered, top 10 among all 50 states for vaccines being administered. If we get shipments from the feds, they end up in somebody's arm in very short order. I know everybody's anxious about all this, but it's important to remember that everyone who wants a vaccine will get one, and that practically no other state in America is moving as quickly as we are and as equitably as we are here in Massachusetts. As of yesterday, 1.6 million individuals have received a Pfizer or Moderna first dose, and almost 63,000 people have received a single dose of the J&J vaccine. 946,306 people in Massachusetts at this point are currently fully vaccinated. And in the next 24 hours, we expect to go over 1 million Massachusetts residents fully vaccinated against this terrible virus. That obviously is a significant milestone for the people of Massachusetts and a real tribute and comment about the quality of the people and the organizations that have come together to create the very robust vaccination system that we have here in Massachusetts. We are one of a handful of states that's vaccinated as many people as quickly as we have. We are getting through this. We can only move as fast as the manufacturers produce vaccines, and thankfully production is picking up. We've been talking with the federal government constantly throughout this pandemic, and yesterday we were able to get some assurances around how many doses we can expect in the next few weeks and into April. Those assurances represent an increase in supply that will be heading to Massachusetts as well as to many other states, and will benefit both our state allocation as well as the federal delivery system. This week we also saw a solid boost in that federal allocation for the pharmacy program, as well as more for federally qualified community health centers receiving doses directly from the federal government. And that makes it possible for us to put together a clear schedule for when all residents will be eligible to be vaccinated here in Massachusetts. Now, back in December, we announced that the general population would become eligible sometime in late April or early May, and that qualified workers would be eligible several weeks before that. Today, Massachusetts remains on track to meet those original milestones. On March 22nd, people ages 60 or older and qualified workers will become eligible. On March 5th, people age 55 and older. April 5th. No. Yes, April 5th. Sorry. Yeah. Okay, sorry. On April 5th, 2021, people age 55 and older and people with one qualified medical condition will become eligible. And April 19th, Patriots Day, the general public will become eligible to be vaccinated here in the Commonwealth. For a complete list of who qualifies as a qualified worker, please visit mass.gov/COVID vaccine. With assurances that the supply chain will continue to open up, we're also taking an additional step to prioritize people who are 60 and older and people who are 55 and older. There's a very strong and important correlation between COVID and age. And we believe adding these groups by age will help us vaccinate more of our most vulnerable population faster. We all know that the anxiety that's created by this process can be stressful for many people, and we hope that this clarity will help everybody plan ahead and know what to expect and when. These dates are when people will become eligible, and it will take time, obviously, for the vaccine to arrive here in Massachusetts and for everyone in these groups to get appointments and to get vaccinated. As a reminder, all Massachusetts residents can sign up today for the pre-registration system which will then allow people to be notified when it's their turn to book an appointment at one of the 7 mass vaccination sites that are near them. And again, this is just for now for the 7 mass vaccination sites. More sites will be added to the pre-registration system in April. All eligible residents can book appointments at any of the other over 200 public vaccination sites that are available through mass.gov, through the mass.gov website. This includes pharmacies, regional collaborative sites, and some local Board of Health sites. Appointments at these sites come online on a rolling basis throughout the week, so please check mass.gov/vaccine to book at those sites. And as a reminder, these dates are when we plan to make these groups eligible. It could take several weeks for the vaccine to get to Massachusetts so that everybody can get an appointment, and that will, at the end of the day, all depend on the availability of federal supply. We've obviously been working hard with a lot of partners, including folks like this, to build up our ability to administer doses when we get them, so we're ready whenever the increased supply shows up. And we have the ability at this point to administer far more doses than we're actually receiving. In addition to the public vaccination sites that I mentioned, hospitals and community health centers continue to notify their patients when they're eligible to set up an appointment. And we should remember that hospitals and health centers are administering a tremendous amount of vaccine. They are a very big reason about why Massachusetts leads almost every other state in the country in this effort. Now, for the week that's next week, this week's order for next week, we've been informed by the federal government that we'll receive 316,000 first and second doses. This includes about 170,000 first doses and a bit of a surprise, 8,000 unanticipated doses of J&J, the single-dose vaccine. These will be distributed to the mass vaccination sites, to hospitals, to health centers, pharmacies, and all of the other 170 public sites across the state. Having so many sites across Massachusetts, like the one here in Brockton, ensures that everybody will be able to have access to a vaccine when it's their turn. Community health centers have long played a critical role in the Commonwealth's public health system. They know their communities well, and they are trusted voices for their residents who have health concerns. They've been strong partners in the fight against COVID, helping with testing and tracing efforts, answering resident concerns, and now helping to vaccinate folks in their communities. Here in Brockton, the Brockton Neighborhood Health Center has helped administer over 7,200 doses to date across several sites like this one. And so far, over 4,100 doses have been given here, right, since you launched on March 1st. And doses are being administered, as you all saw, by the Mass National Guard. The site has the capacity at this point to do between 500 and 700 doses a day. I had a big discussion with Marie about whether or not maybe they could do a few more at some point in time, which we'd be happy to help them with. But it's important to remember that these local efforts by community health centers have been a big part of getting vaccines to people in many of our most vulnerable communities and ensuring quality in that vaccine delivery process. I want to say thanks again to the mayor, to the city council, and to the folks here in Brockton, and to the National Guard for their partnership in working with the Brockton Neighborhood Health Center to get this done. The news about the arrival of more vaccine from the federal government moves we will be able to move faster to get doses to our residents, and this is long overdue and welcome. We're all eager to get back to something like normal and see our friends and loved ones again. The vaccines can't come fast enough, but it's important we don't forget that COVID is still very much with us and that it's going to be with us for the foreseeable future. We can't let our guard down, and we certainly shouldn't do so when we're this close to the finish line. That means we have to continue to practice the stuff that's worked over the course of the past year, wearing a mask, keeping your distance, and practicing good hygiene, and staying home if you feel sick, and continuing to get tested. I'm going to mention this one again, continuing to get tested. There's been an enormous amount of focus, which we all understand why, on vaccines and vaccinations over the course of the past couple of months. Testing, we should all remember, is free at hundreds of sites across the Commonwealth, and it remains an enormously powerful tool in detecting and stopping the spread of the virus. People need, if you think you've been around somebody who's been exposed or you don't feel well, you need to continue to get tested. Testing in Massachusetts has been a critical part of how we've dealt with and managed our way through this pandemic. We built a testing infrastructure that made it possible for us to be the second largest per capita tester in the continental United States. The infrastructure is there. We've decided to continue to run that infrastructure through the end of June. We think it's really important for people, if they have concerns, to continue to get tested. It's a big part of how everybody can continue to do their part to keep themselves, their friends, their families, and their neighbors safe while we work through vaccination programs here and across the Commonwealth to put this virus behind us. So if you have concerns, please get tested.